My form is 1 in 250 people in the population, but there are only 10% of us actually diagnosed in the world. It causes premature cardiovascular disease and a high risk of stroke or heart attack. I had sudden chest pain, wouldn't go away, and it was prolonged, and I was concerned I might be having a heart attack. Well, it's with you every day. Well, I don't really think that women know their risk for cardiovascular disease, because it is the biggest killer in the world for everyone, but for women specifically.
Welcome to the Pioneering Patient Podcast. I'm Michael George of SAGES Healthcare Consulting. Now, this episode comes to you in partnership with Global Heart Hub, the international alliance that provides a voice for those affected by and living with cardiovascular disease. Now, two of the important messages that Global Heart Hub will communicate are the importance of knowing your own cardiovascular family history and addressing the suboptimal treatment of women cardiovascular patients. And those are two issues that will come up in my discussion today with our guest, Patsy Petrie from Scotland in the UK. Patsy, welcome to the podcast.
Oh, it's nice to be here.
Thank you, yes. And so you're represented today, you're an ambassador for FH Europe, familial hypercholesterolemia Europe. So tell me what is more about the organisation and what it does.
So FH Europe Foundation is a patient organisation, and it represents patients with familial hyperlipidemias.
Yep.
FH is one of those, but there are others.
Yep.
Probably less known. My condition is common.
Yeah.
There is another common condition called lipoprotein A, and then there are two rare conditions. The rare form of my condition and familial chylomicronemia syndrome. So FH Europe Foundation represents patients that have these conditions, and also advocates for them, supports them, and they're based in the Netherlands.
You have familial hypercholesterolemia, if I can say it correctly.
Yes.
So what that's saying, it runs in the family, and it's high cholesterol. So what are the risks, the dangers of having that high level of cholesterol?
So can I just explain firstly that FH is inherited, genetic high cholesterol. It's not able to be controlled by a lifestyle and diet, which normal high cholesterol can be. Is usually caused by people not looking after themselves, eating the wrong things, drinking the wrong things, not exercising. But in my case, that isn't true. So FH, as you said, it runs in the family. So if you have it, it means that your parents had it and probably your grandparents. You have a 50% chance of inheriting it from one of your parents. So not every child will necessarily have it. In a family, but if you have it, you can pass it to your children, and so on.
And so there's heterozygous and homozygous.
Yeah.
What's the difference between those two?
So I have heterozygous FH, which means that I inherited it from one of my parents, and I don't know which one. And so I say one gene from one parent. Yeah. But if you have homozygous FH, it means you've inherited a gene from each parent, so your mother and your father. And homozygous FH is rare. My form is 1 in 250 people in the population, but there are only 10% of us actually diagnosed in the world. And there are 1 in 300,000 people in the world have homozygous FH, so they form where they have the double gene.
Yeah.
And it means that you will become incredibly ill in childhood and possibly die without treatment.
So in some ways you're lucky to have heterozygous.
In some ways I have to count myself lucky, although with either condition it causes premature cardiovascular disease and a high risk of stroke or heart attack.
Yeah. And so it's elevated cholesterol. Yeah. So let's say, I don't know, assuming I don't have it because I've not been diagnosed for this, but what would my cholesterol levels be compared with someone like you who has that elevated level? What would the comparison be?
Well, if you have your cholesterol to target, the normal cholesterol level, you would have a level of 5 millimoles per litre.
Yeah.
But in the case of someone like me, you will have double that. And when I was first diagnosed, my level was 10.7 millimoles per litre. Yeah. So that obviously isn't normal. No. And needs to be treated with some sort of therapy. You can't treat that with diet and lifestyle on its own.
No. So it's genetic, it's inherited, it's not blameworthy. You can't do anything about getting it, but what can you do once you know you have FH about lifestyle and other things to manage it?
Well, we say lifestyle and your diet becomes an incredibly important factor. So you need to make sure that you're eating low saturated fats, that you're exercising regularly, that you avoid alcohol, you avoid smoking. Yeah. Everything that, all these vices you need to avoid, And that becomes incredibly important because these will exacerbate your symptoms when you get them. But unfortunately with FH, it's completely invisible. It's asymptomatic. So you are carrying it without knowing that you have it unless it's diagnosed.
Yeah. And it's important therefore to diagnose it young. Yeah. And you have a particular idea for how to screen for it at an early age. Tell me more about that.
Well, it's not just my idea. I don't take credit for it, but I do support it, and that is that all babies should be ideally screened. They do a blood screening for babies, a heel prick test anyway, for conditions. I think there's 9 in the UK that are currently screened. So we, as FH Europe Foundation, advocate for the newborn screening programme, or at least for children to be tested by the age of 5. Mm-hmm. That does happen in Holland at the moment and some other countries, but in other countries it doesn't happen at all. And it varies the number of conditions across countries as well. We necessarily have 40 conditions screened. So yeah, it's really important in a case of FH, if you have a hyperlipidemia, that it's caught early and that you can be treated. So that's why we advocate for this early intervention.
And so some people might say, well, of course, how can you do it? It can't be easy to do it with newborn babies. It's high cost. What would you say to that?
It's going to be a higher cost if you don't do it. Yeah. Because you will have lots of people with premature cardiovascular disease. Some of them may die, but some of them might not. And then you've got the cost of treating those people further down the line. And also, if you don't find these people, the problem gets bigger because they pass it on through generation upon generation. So I can't see why it would be a problem. It would save, the cost to families, the cost to the health system, the burden of carers and everybody else if that was done.
So saving considerable future costs is what you're saying. So let's come back to your story, your history. When you were young, did you have any idea? You were active, you were sporting, did you have any idea? You would get on with your life, weren't you?
Yeah, I had no idea whatsoever. Yeah. But obviously I'm the first in my family to ever be diagnosed genetically, so my parents had no idea that they had this either. I was brought up in a country environment. My grandfather had a fruit farm. I was out doing things in the fields, picking berries, picking potatoes. I was very fit, I was athletic. My father was too, and he encouraged me to get into sport, and I was house captain at school. I played just about everything that was going. If nobody else would volunteer, I would be playing tennis, badminton, netball, volleyball, swimming, cycling. I just had no idea whatsoever, and I was a little bit thinner than I am now back in the day. However, I had no reason to believe that I had anything that would cause me a problem.
So we come now to 2003, when you first realised, perhaps not you had FH, but that you realised there was something there and you had high cholesterol. So tell me about that. You were working in Scotland's big banks and...
Yeah, I was working in one of the biggest banks in Scotland at the time, and I had sudden chest pain one day at work and was concerned because it wouldn't go away and it was prolonged, and I happened to have someone who was trained in first aid work with me who was concerned as well and said, I don't know, I think you maybe need to go to a hospital, and called an ambulance. So off I went to Edinburgh Royal Infirmary, and they checked me out did all the various tests, ECG and so on, to check for heart issues. I was concerned I might be having a heart attack because my father had a triple heart bypass in 1996 at the age of 57. And I wasn't sure why he had a heart problem. So I thought, could I be having one? So they did all the tests. They said no, there was nothing to be concerned about with my heart. However, they did do some blood tests and they discovered that my cholesterol was 10.7 at the age of 36.
Yes.
So that was cause for concern, and they said you really need to see a GP or someone to take action on that. That's just not normal for someone of your age and your fitness and other things. So I did then go to my doctor and say, I don't really understand this, but I've got extremely high cholesterol. What should I do about it?
So what were you diagnosed with at that stage?
At that stage, they diagnosed the pain as being an esophageal spasm. Which I hadn't heard of, but apparently it does occur occasionally, and it's mostly in women. So of course I thought, that must be what it is. You take the word of your, consultants. So I did mention that was what had happened to the GP, but I said, but there is a cholesterol issue here, and we need to sort. So
in some ways, the hospital was putting it back to the GP, but shouldn't they be thinking, wait, there's a family history here. You've got elevated cholesterol. Shouldn't we be testing for something else? So they put it back to the GP rather than...
They did, but then I was at A&E. So, usually when you go to A&E, and I've been there quite a few times for a number of things, they just diagnose the immediate problem, and then they do tend to pass it back to your GP to then look into further. But my GP at the time never looked any further than saying, well, we need to get it down. But he never said there was any other condition that I might have. He just said, we need to give you some statins, and I was put on the common one, which is simvastatin, and that didn't bring it down enough. And then they said, well, maybe try something stronger. So atorvastatin was reeled out, and the dose kept going up, and I kept taking that for 14 years.
14 years,
and then in 2017, which is now 14 years since the original esophageal spasm and detection of the cholesterol, my GP changed. And this particular GP happened to be a lady, but it might not have been, said, I don't really understand why your cholesterol is still as high on the medication that you're taking. Therefore, I think we need to look at, you might have a condition called familial hypercholesterolemia. And of course I said, I've got what? I hadn't any idea what that was. And she said, would you be prepared to give a blood test to get genetically tested? And I said, of course. If I've got something, I want to know what it is and I want to be able to treat it. So it went off, and it was proven that I had heterozygous FH. And at that point, they said, and this could be in other members of your family. So this is called a cascade testing screening, and we now have to tell you that you're advised to tell your parents and to tell any siblings that you have that they could also have this condition. And if they have children, they could have passed it to them as well.
So you got everyone tested in your family?
Well, my parents sadly were too unwell at that point in 2017, and in fact my father passed away in November 2018, and then my mother in the following February 2019. So neither of them are actually tested, which means I don't actually know which side of my family inherited it from.
So over these 14 years, do you think, well, why did the GP never have the curiosity to say, well, we'll keep managing this with statins, it's not going down, there must be something else? Do you feel...
I was a bit shocked that it hadn't ever been picked up. So I did have mixed feelings, because I thought, it's not anger, but disappointment maybe that, this hadn't been picked up early, and it could have been. But then I did appreciate that maybe at the time in 2003, the doctors weren't as educated in genetics and in these conditions, hyperlipidemia and specifically FH, and therefore they hadn't thought that this could potentially be what I had. But so it was a mixed feeling about it. But then I thought, well, at least I've been identified now, so I can hopefully do something about it. As best I can.
And so, do you think back, if you'd have known 2003 or earlier that you had FH, you could have changed things, you could have done things to address that? Do you feel that you missed out on that?
Well, yeah, anybody who isn't diagnosed early does miss out because they can start treatment early, and I didn't. I was 50 before I got my diagnosis. So, I was on some treatment, which obviously benefited me. However, I could have had better treatment and more targeted treatment. And obviously other members of my family could have been identified more quickly as well. So, it was a bit disappointing, but as I say, what can you do but just, do what you can now, and take all the measures you can to avoid the risk.
And so how has this impacted your health? How is it impacting your health now? I think menopause has come to also impact that.
It has. So there's, once you've got a condition, there's a certain amount of anxiety around it because you're like a ticking time bomb, if you like. You're doing everything right, but there's still a risk. And then you get to menopause, and that changes the situation for women with FH, because up to that point they're protected to some extent with their hormones. So you tend to find FH develops more quickly in men because women have this protection. But once you go through menopause, your hormonal levels drop, and therefore your protection also disappears. And therefore you're at highest risk then of any cardiovascular event happening. So in order to alleviate that, I think a lot of women don't know that if HRT can protect your heart, and it didn't used to be the case, I didn't believe that it did, but I've taken measures to ask my GP if I could take HRT, not just for the menopausal symptoms, of which I had practically every symptom, but also for the protection of my heart, and he has agreed that that's okay, and I'm actually start taking it in March. So, but I think in the long run, it will hopefully be of benefit to me.
And so living with this, and you have a number of other conditions as well, is a big strain on you mentally, I think.
Well, it's with you every day, and as an advocate, obviously you're talking about it a lot, and you're advocating it for a lot, and it's not just that, it's remembering the impact it's had on your family, what happened to them, and the experience that you lived through with them. And it didn't just have a physical impact, it also had a mental impact on my family members. So it's all of that. I think it is a strain, it is this anxiety, and obviously consciously thinking about it every day, about your food and your exercise and just everything that you need to do.
You now know, you've known since 2017 that you have FH. So how has that helped you? How have you been able to manage your situation better as a result of that?
Well, now that I know I have it, I am seen regularly by a consultant lipidologist as part of the cardiology department at Edinburgh Royal Infirmary. I'm monitored regularly. Got a review just coming up. So it's every year. They check your levels of cholesterol and your blood pressure and everything, just that you're sure you're all okay. So you have that and the reassurance of that, but also because I didn't actually know what state my arteries were in, which was a bit of a worry because I thought my father had 3 arteries totally blocked by the age of 57, and I've just passed that age, 59 now. I decided to go and have a CT coronary angiogram done privately, but also a carotid artery scan done privately, because that isn't available on the NHS until you have an event, which is really not what you want to happen. So too late. And therefore, for me, that was worth the money to go in and have that reassurance. And unfortunately, my main arteries are clear as far as they can see. That doesn't mean
there are little ones that I'm not aware of that could potentially have atherosclerosis in them.
So you don't have a cardiovascular disease, but the potential for that. Apart from you don't know what that.
Well, I don't know if I've got a cardiovascular disease because nothing's showing that I have.
Yeah.
But my condition, that's what it leads to.
Yeah. You live with the fear of that.
Yes.
Yeah. So I speak to a lot of women patients, and we hear this all the time. In your case, misdiagnosis. So why do you think this is happening? What should be done about it?
Well, I don't really think that women know their risk for cardiovascular disease because it is the biggest killer in the world for everyone, but for women specifically as well. Most women think they're likely to die of something like breast cancer rather than a cardiovascular problem. They're not very well informed, but the public isn't either. They don't tend to get thorough examination in this area. There aren't enough female cardiologists. Not that that would necessarily help, but it might.
Yeah.
Also, women's cardiovascular disease is under-researched. It's under-treated. Women haven't been studied historically. And women, as I've said, aren't small men. They've got a physiology that is different. So it needs to be studied properly.
And so the Global Heart Hub, our partner for this podcast, brings together the cardiovascular community around the world. So as a patient, a woman patient, and an affiliate of the Global Heart Hub, how important is that organisation to you, the support of the Global Heart Hub to you?
It's very important for me to be part of it because, I feel supported. It's a community. We help each other. But I'm proud as a woman to be part of it as well, to help focus on that specifically. But obviously to help with any cardiovascular disease, mine just happens to be one of the conditions that Global Heart Hub helps to support. F.H. Foundation is specifically, obviously, my area of clinical area. But I'm very proud to be part of this organisation.
Yeah, and you're part of a number of patient organisations, you're patient advocates. So what do you think patients advocates should be doing to advocate? Because you say things aren't happening fast enough. So why do you say that? And what should patient groups be doing?
The health systems seem to be treating people rather than preventing disease. I think that's beginning to be recognised now. But unless we start preventing disease, it's going to compound and the burden will get greater and greater on our National Health Service and on patients and their families. So it's just changing that thinking so that we're not dealing with the outcome of, not taking earlier action or an intervention that could stop disease.
So if I were to say to you, you talked before about childhood screening, newborn screening. So what are a couple of other things, 2 or 3 other things you say you want to see change in healthcare systems? What would you be advocating for?
Well, at the moment, many countries don't have any cardiovascular plans at all. So that's something else that we as advocates and patient organisations promote, that every country should have a cardiovascular plan, and in that plan, women should be included specifically. I'd like to see some of our advocacy come to fruition. That will happen in the rest of my life, whatever that might be. Whatever time in the next 5 to 10 years or maybe longer, that will actually happen.
Yeah. And if you're able to go back and talk to 20-year-old Patsy, what advice, with your knowledge now, what would you be telling her?
I would say you need to be more informed about aspects specifically of women's health around cardiovascular disease, but other things as well. Not just think about it in the gynecological sense. Make sure, once you do know about all these things, just keep educating yourself. That you educate clinicians as well, because some of them are not well educated. Advocate for yourself always. Always go. Don't let them get away with it. Say to them, well, I believe this or I believe that, and just keep encouraging them to look further.
So Patsy, last question. Looking the next few years ahead, 5 years ahead, what's it going to look like for you? What do you plan to do? What would you like to see happen?
Well, I'm just continuing with my advocacy, really, and it's growing organically. So yeah, working on a national level and a European level and a global level, and it seems to, I'm continually finding opportunities and ways to do that. Out of my own initiative in many ways, but it's facilitated, thankfully, by patient organisations like FHU Foundation and Global Heart Hub.
Yeah. So thank you, Patsy, for joining the podcast. It's been a privilege to have you here. So thank you.
Thank you very much for having me.
Thank you. So thank you to Patsy. Some interesting points she raised about newborn screening, advocating for yourself, having cardiovascular plans, and educating your physicians as well. So if you have thoughts on that, please add comments below. Thank you to Global Heart Hub for the partnership for this podcast. Please subscribe, hit the subscribe button. Thank you for watching, and finally, please remember to take good care of your health.